I'm Dr. Vinutha, one of the mentor in study MRCOG. So here we are starting the KickStart series, and topic for today is hypersensitivity reactions. It is one of the subtopic of immunology. So the biggest way to predict your future is to create it. Okay, so coming to the topic, what are we going to discuss today is the types of hypersensitivity reactions, immunology of hypersensitivity reactions, and examples of hypersensitivity reactions. Basically, this is a very small topic. In part one, in this topic, you will be mostly asked about the examples and the immunology part. So the types of hypersensitivity reactions are classified into type 1, type 2, type 3, and type 4. So based on the mechanism, antibody mediated and cell mediated, these are the two ways with which all the hypersensitivity acts. That is, so the type 1, 2, 3 acts by antibody mediated, and type 4 acts by cell mediated. Okay, so just to break down the things for you, what is hypersensitivity? What is sensitivity? So basically, our body responds to all the foreign antigens. Okay, so the response generated by our body to foreign antigens is to protect our body. Okay, so sometimes what happens is this reaction can be much more accelerated, or this response can be much more intense in its action, leading to hypersensitivity. In the place of protecting our own tissues, our own immune system is causing damage to the tissues. This is what this hypersensitivity as such means. So there are two phases of this hypersensitivity reaction, that is sensitization phase and effector phase. Sensitization phase is a phase where the memory T cells and B cells develop, and effector phase is where they elicit inflammatory response. So even though this sensitization phase and effector phase is present in all four types of hypersensitivity reaction, the duration of each varies based on the reaction. So coming to type 1 hypersensitivity reaction, it is a IgE mediated with symptoms usually occurring within minutes following the patient's re-encounter with an antigen. It requires immediate medical interventions. For example, there is a snake bite, or there is some hay fever, or there is a sudden acute episode of asthma because of some allergen or pollen. So this can manifest as asthma, anaphylaxis, hay fever, or even urticaria. This at times can be life-threatening. So as I discussed with you, it is a IgE mediated reaction. So what happens in the sensitization phase, the antigen comes and binds to the Fc receptors of the B cells, that is the basophil cells, or the mast cells. This IgE binds IgE Fc receptors on the mast cells or the basophil cells, and then in the effector phase, this stimulates release of so many neuromediators like histamine and serotonin, bradykinin, many other things. So this is what is the mechanism by which the type 1 acts. So what are the mediators which are released during this is histamine, serotonin, leukotrienes, prostaglandins, bradykinin, and proteases. All these causes smooth muscle contraction, vasodilation, increased permeability, platelet aggregation, and mucus secretion. So these effects can lead to symptoms like asthma, hay fever, skin rashes, local anaphylactic reactions, and systemic anaphylaxis. So type 1 hypersensitivity reaction can be as simple as wheel and flare effect to life-threatening systemic anaphylaxis. Moving on to type 2 hypersensitivity reaction. So this is formation of antigen antibody complex between foreign antigen and the IgM or IgG immunoglobulins. This is mediated by direct effects of antibody and killing mediated by complement or antibody dependent cytotoxicity. So if you look at the examples, blood transfusion reactions and hemolytic disease of newborn are most important among these. So what happens in blood transfusion reaction? The preformed antibodies bind to RBC antigen and it just activates the complement system leading to lysis of RBCs. Basically, the complement system thinks that this is a foreign antigen, it recognizes it as a foreign thing and starts destroying it. Same thing happens in hemolytic disease of newborn. So in hemolytic disease of newborn, you know the mother is Rh negative and the child or the fetus is Rh positive. In the first sensitization, the mother is Rh negative. So mother doesn't have D and the child has D. So when the child sends some of its anti-D or Rhd cells to the maternal circulation, mother recognizes this as a foreign thing and starts producing antibodies. In the subsequent pregnancy, what happens if the child turns out to be Rh positive? This antibodies which are preformed in the first pregnancy goes and attacks the second child RBCs, leading to destruction of the RBCs. Okay, so that is how the hemolysis happens. So why does this happen in only second pregnancy? Why not in first pregnancy? That is because of IgG and IgM. So moving on to the type 3 hypersensitivity reaction, this is mediated by the formation of antigen-antibody complexes, either activate complement directly, increases vascular permeability and recruit neutrophils at the site of complex deposition. So action of lytic enzymes released by neutrophils. So it can appear as skin rashes or glomerulonephritis or arthritis. So it occurs in 3 to 4 days after exposure to the antigen. So here you have to understand one thing, that the difference between the type 2 and type 3 hypersensitivity reaction. So type 2 is IgG or IgM mediated, which goes and directly activates the complement system. Whereas type 3 forms an immune complex, that is antigen-antibody complex is formed, and this complex goes and deposits in a tissue like your kidney. If it goes and gets deposited in your kidney, and that activates complement system, which leads to glomerulonephritis. So this will be more pertaining to the tissue. So the local destruction happens in the kidney, or if it is happening in the joints, it leads to arthritis like that. So that is the main difference between type 2 and type 3. Coming to type 4 hypersensitivity reaction. So it is a delayed type of reaction. This is the only one which is cell mediated. So here, what is the cell which is mediating this? That is helper T cells. So this induces a local inflammatory response. There will be influx of macrophages. The best example for this is contact dermatitis or poison ivy. So what happens in this mechanism is, again, this, as you see, there is a sensitization phase here, and the effector phase here. In the initial contact with antigen, this is our APC, that is antigen presenting cell. So this cell will engulf all the antigens and this presents to the helper T cells. Once it is presented to the helper T cells, two things will happen. One is there will be formation of the memory. So this cell will be able to, our body will be able to recognize these antigens in the subsequent attacks. So what happens here is there will be production of interleukin 2. So with the subsequent attack or a little later, what happens as soon as this comes in contact with the antigen, that is the helper T cells comes in contact with the antigen, or when the macrophages present these antigens, it will start releasing cytokines. So various cytokines like cytokine A, number 8, 3, and tumor necrotic factor alpha and colony stimulating factors, all these cytokines are released into the circulation, leading to various actions like chemotaxis of macrophages, activation of macrophages, induction of myelopoiesis of macrophages and neutrophil precursors, chemotaxis, and extravasation of macrophages. So all these things then later lead to delayed action, which might take several days. Like in contact dermatitis, you wear a slipper, you don't get the reaction immediately. You get it after 48 hours or even up to 1 week. Same thing happens in host versus graft rejection in case of graft. As soon as the transplant has happened, there is no immediate rejection because of two reasons. One, body tries to figure out what this is, and second thing, the patient will be on a lot of immunomodulators and immunosuppressants. So later, after few days, that the body recognizes this, okay, this is not the part of my body, this has come from outside, or this is not something which I am familiar with. That is the time where this type 4 hypersensitivity understands this and starts producing this cytotoxic substances, leading to hypersensitivity reaction. So this type 4 hypersensitivity reaction is divided into 4A, B, C, and D. So the 4A corresponds to the classic monocytic tuberculin type delayed hypersensitivity mediated by helper T cell 1 and helper T17 cells. Type B corresponds to the eosinophilic mediated inflammation which is produced by helper 2 cells. Type C corresponds to tissue damage produced by cytotoxic T cells and can have either granosines B, perforans, or phage-like killing mechanisms. Type 4 hypersensitivity produces tissue damage by the infiltration of neutrophils attracted by interleukin 8 from helper 17 responses. So this slide is like more or less I have put for you to understand the mechanisms by which type 4 can act. This A, B, C, D is like not so important. But you have to understand these mechanisms for you to remember the examples better. So to summarize, we have type 1, type 2, type 3, and type 4 reactions, and we have this entire chart so that it is easy to remember and to compare. So in type 1, the mediators is IgE, antigen is soluble antigen. Mechanism of action is allergen specific IgE causes mast cell degranulation, releasing histamine and other inflammatory mediators. This can happen within seconds, minutes, and the late phase can occur within 8 to 12 hours after the exposure. So the examples include anaphylaxis, hay fever, food allergy, drug allergy, eczema, and asthma. Type 2 is IgG or IgM mediated. This antigen binds to IgG or IgM, and it is going to activate the complement system. So this generally takes hours to days for the manifestation. Two most important examples for this is acute transfusion reaction and hemolytic disease of newborn. And type 3 is antigen antibody complex. So then again it is a soluble antigen. Antigen antibody complex is formed that goes and gets deposited in one of the tissue, and then from there it activates the complement system. So it can typically take hours to days for this to happen. So what are the examples in that? The examples are rheumatoid arthritis, then post-streptococcal glomerulonephritis, and SLE, that is systemic lupus erythematosus. Then we have type 4 hypersensitivity reaction, that is T cell mediated. This is the only cell mediated, whereas all other three are antigen antibody mediated. So here it can be soluble or cell-bound antigen. Antigen presenting cells activate T helper 1 cytotoxic T cells. These T cells recruit macrophages and release inflammatory cytokines. This typically takes days for the reaction to take place, and it is also known as delayed hypersensitivity reaction. So the examples for this are contact dermatitis, tuberculosis, and graft rejection. So now we shall solve some most frequently asked questions from this part. So the first question is, type 1 hypersensitivity is mediated by which type of antibodies? So the options are IgA, E, M, and G. So I know you all have very well understood that the answer is IgE. So IgE is the correct answer. So it is a hypersensitivity reaction, type 1 hypersensitivity reaction that consists of a IgE-mediated hypersensitive response found in anaphylaxis and asthma attacks. So I have repeated anaphylaxis and asthma so that, like, again you recollect that type 1 hypersensitivity examples are again anaphylaxis and asthma. So coming to the second question, the type of hypersensitivity mediated by antibody dependent cytotoxicity is. So it is an antibody dependent. So you know IgG and IgM. So IgG and IgM comes in which type of hypersensitivity reaction? So it is type 2. So type 2 hypersensitivity is mediated by the direct effects of antibody and killing mediated by complement or antibody dependent cytotoxicity. So one question regarding the examples, that is examples of type 1 hypersensitivity are except. So you have in options anaphylaxis, hay fever, asthma, and contact dermatitis. So you very well know contact dermatitis is type 4 hypersensitivity reaction. Rest all are type 1. So just to revise, what are the examples for type 1 hypersensitivity reactions? You have asthma, hay fever, food allergies, and drug allergy. Most common is your peanut allergy. So coming to the fourth question, the time course for type 4 hypersensitivity reaction is type 4. So type 4 is contact dermatitis. So just for you to understand and remember better, contact dermatitis will not be immediate. So it can take days together for it to happen. So it is a T cell helper T cell mediated delayed reaction. So examples again I'm repeating, that is contact dermatitis, tuberculosis, and graft rejection. So the last question for today, the types of hypersensitivity reaction where antigen antibody complexes are deposited in tissue. So I told you the difference between type 2 and type 3. Type 2, it is IgG or IgM binding to an antigen, and that immediately triggers the complement system. Type 3 is the antigen antibody complex is formed, which is going to get deposited in a tissue. So it can get deposited in kidney. If it gets deposited in kidney and it triggers a complement system, then it is going to cause your post-streptococcal glomerulonephritis. So this complex deposition in the tissues is type 3 hypersensitivity reaction. I hope you've understood, because I'm trying to explain again and again so that you don't make any mistake in this hypersensitivity reactions. Okay, so the answer is type 3. Here the antigen antibody complexes are deposited in tissues where they activate complement chain, causing local inflammatory and recruitment of leukocytes. So again, to repeat, the time course is, it can take from hours to days. The best examples are your post-streptococcal glomerulonephritis, SLE, and rheumatoid arthritis. So to summarize, we will just recap very quickly all the 4 types of hypersensitivity reaction. So type 1 is mediated by IgE and antigen form is soluble antigen. Mechanism of action is that it releases histamine and other inflammatory reactions, and it takes anywhere from minutes to hours to manifest. And examples are anaphylaxis, hay fever, food allergy, drug allergy, eczema, and asthma. Type 2 is mediated by IgG and IgM. Here it is cell-bound antigen. IgG and IgN binds to antigen and triggers the complement activation, and this will lead to cell destruction. So the best examples are acute transfusion reaction and hemolytic disease of newborn. This can start anywhere between hours to days. Coming to type 3 is antigen antibody complex that deposits in the tissue. This is the keyword. You should never forget this keyword. So again, it is a soluble form antigen. And so once this gets deposited in the tissue, it causes local inflammation and recruitment of leukocytes takes place. And this can occur anywhere between hours to days. So the examples are rheumatoid arthritis, post-streptococcal glomerulonephritis, and systemic lupus erythematosus. So the type 4 hypersensitivity reaction is cell-mediated, that is T-cell mediated. So the antigen can be either soluble or cell-bound antigen, and the mechanism of action is that this antigen presenting cells activate helper T cells that recruit further macrophages, and it releases inflammatory cytokines. So it's a delayed one. So very well you will remember contact dermatitis, tuberculin test, and graft rejection. So I told you the best way to predict your future is to create your own, and you are the creator of your own destiny. We are all your facilitators. We at Study Medic, we have various programs with us, and we are catering to all the national and international students, and many students have got benefited from us. And I highly recommend you, because this is the best platform to explore what you like and what you want to achieve. It would be a great opportunity for the students ahead in time. Like you can really learn a lot through this platform. I wish you all the very best for your preparation and exams. I hope this hypersensitivity topic is clear to you. All the best. Thank you.